Dr. Anita Rairala, Professor of Psychiatry at Government Hospital for Mental Care, Hyderabad. This morning I am going to speak about psychological problems which we see in postpartum period. Postpartum period is usually we call postpartum period when it is after delivery. Lasts from after delivery, it lasts till 6 months time. So during this period, the psychological problems are very common. So these psychological problems can be like postpartum blues or like postpartum depression or postpartum psychosis. Postpartum blues is a very common condition which we see in females after delivery. In this condition, they usually present with multiple problems like anxiety or sometimes depression and weeping spells, irritability, and also mood swings. So they commonly present with all the symptoms. So these symptoms are very commonly seen after delivery because these symptoms can be because of the change in the life of the person, because after delivery there will be a child. She needs to take care of the child and she needs to feed her. Sometimes there will be sleep disturbances, and also after delivery there will be some hormonal changes also. So because of all these conditions and also because of the stress, they will end up having postpartum blues. Sometimes it goes to severe variety like postpartum depression. In postpartum depression, it is also seen after delivery only in about 15% of the individuals. This is the presentation is like they will have symptoms like depression and weeping spells, and they feel very lonely. They feel that no one is loving them, and sometimes they also have suicidal ideas. They want to kill themselves, or they feel worthless. Why am I living? It's better for me to die. So all the symptoms can be there. So when these symptoms are present, we call them as postpartum depression, and it is a very difficult condition to treat, and also it is a very difficult to handle that situation for the family members. So it is always advisable to show the patient to the psychiatrist or a psychologist and get treatment done. And at that point of time, more amount of support is necessary from the family members to the person, and also to give her enough rest, and also to understand her emotions and to validate her emotions, and trying to support her in whatever she feels if she needs something, we have to give provision for her needs also. So this is about postpartum depression, and the severe variety is postpartum psychosis, where they present with psychotic symptoms like delusions and hallucinations. They feel that somebody is following them. They feel that everyone is hostile towards them, or sometimes they hear voices. So this is not very common, but this is also present in postpartum period. So postpartum psychosis, they turn violent sometimes, they become suicidal, or they injure others also, injure the baby also. So we need to be very careful in handling this postpartum situations. Many people don't understand that it is a psychological condition and try to intervene in very different ways, and thereby increasing the problem. So the best thing to do is when it is a postpartum blue, we need to give her proper support. The family members should give her enough time and try to understand her feelings, and giving her enough rest is the most important thing. But when there is postpartum depression or psychosis, they just need to understand the symptoms and then immediately take her to a psychiatrist for treatment. Thank you.